My name is Christina Synowiec, and I work with Results for Development, which is a nonprofit based in Washington, D.C. that works with change agents around the world to create self-sustaining systems to support healthy and educated people. As the director on our evaluation and adaptive learning practice, I lead an initiative that Tom described called Rapid Feedback, Monitoring, Evaluation, Research, and Learning, or RF-MERL, where we're essentially the prime on a consortium of organizations working within USAID to generate evidence and feedback necessary to inform ongoing design decisions. We're one of several innovative M&E mechanisms that are being piloted through the support of USAID's Global Development Lab. And given the parallels between the work that we're doing within USAID on how to get better faster within their country programs, and what the CURVE initiative is piloting within the Gates Foundation, we were invited to participate in the community of practice that is being led by MNC Saatchi and their partners. In previous discussions with MNC Saatchi and also other members of the community of practice, there was a lot of interest in how we've used theories of change, or TOCs, to help programs get better faster. What's our approach to developing TOCs, and how do we actually use and apply them to make better decisions? And so that's what really resulted in this presentation today, and what I also shared in the December summit in DC that the CURVE initiative hosted. And my goal is really to cover three different topics. First is the question of why are theories of change so challenging? Everyone talks about them, but quite frankly, they can get a bit of a bad rap. And so I want to dig a little bit into why that is and explore that further. The second topic is, what is a theory of change? Is there an actual definition or template for this process? And then finally, and most importantly, how does one actually apply a theory of change? How do you use it to get better faster? I want to give the caveat that I am by no means formally trained in how to develop TOCs, but rather I've learned by doing them many, many, many times. The ways that a TOC can be, unfortunately, a rote and meaningless exercise, but more excitingly, the many ways that it can be a practical, actionable tool to support ongoing learning opportunities and really improve your potential for impact. So as you can probably tell, I'm a huge TOC convert now and really see them as an invaluable tool. So what I want to do now is go ahead and start off with the challenge of theories of change, or TOCs. There was a report in 2016 on the state of evaluation practice and capacity in the nonprofit sector that shared that 58% of nonprofits report having a TOC, and of those, less than half created or revisited their TOC in the last year. If I'm being completely honest, those numbers were even higher than I had expected, and it really demonstrates how for some organizations and individuals, developing a theory of change is really just a check the box exercise. I think one common challenge is that everyone talks about theories of change, but people are often referring to very different things. In some cases, they mean a results framework, and others they're referring to a logic model, and in other instances, they may just want a general vision or narrative of the overall program. These are all interrelated, which just makes it even more confusing. And while most funders require either a theory of change or logic model as a part of the funding proposal or ongoing reporting process, without having a clear definition or template for what exactly this is, people are often not quite sure how to develop them, or more importantly, how to actually use them, and instead just check the box and move on. Others may understand that a theory of change is a way to chart how to get from a set of activities to your ultimate intended outcomes for a program, but they're not really sure how to visualize that. I saw in one blog post someone describe a theory of change as a way to chart how an intervention takes the world from a place of desolation to utopia, and you see that on the right, or as close to that as possible. So the idea is that your program is supposed to create change, so a theory of change helps to articulate how you actually get there. But the challenge is that explaining how you get from A to Z can take many different forms. There's no one way to visualize or articulate that theory. And that leads to this challenge. A TOC can take many different forms. I've actually been in meetings where I've heard a TOC described as like spaghetti on a wall, or just a whole mess of lines and squiggles that aren't really interpretable to external audiences or even the program team that's involved in implementation. In some cases, that's because the TOC was so complex that the challenge became how to really clearly communicate the narrative there. I would argue that if your TOC is your narrative of change, then it's important to communicate a narrative that can be easily understood by your target audience so that it is not just spaghetti on a wall. But as you can see here, there's no one way to visualize a theory of change. This is just from a really quick Google search that I did, looking for example theories of change. And as you can see, they take all different shapes, forms, and sizes. And I want to emphasize again, that's okay if it tells a clear narrative. I would argue that it doesn't matter how your TOC is visualized or designed, as long as it facilitates deeper reflection on the possible pathways from now to your desired outcomes and ultimate vision. But in order to do that, you really need the TOC to be presented in a way that's useful, understandable, and readable. If it's hard to read and follow, then it's probably hard to actually do in practice. But what does it mean that without an exact to follow, it can be really hard to figure out where to start and where you need to end up? Okay, so I've outlined many and not even all of the challenges of developing and implementing a theory of change approach. But let's say that you're in a position where you actually need to make one, or you're working with a partner and you're asking them to make one. So how do you even know what a theory of change is if it takes many different forms and there are lots of different paths to getting there? Well, even though I said there's no one template or form for a TOC, there are a few guiding principles for it. I really like this definition that I came across. Through this approach, the precise link between activities and the achievement of the long-term goals are more fully understood. This leads to better planning in that activities are linked to a detailed understanding of how change actually happens. It also leads to better evaluation, as it is possible to measure progress towards the achievement of longer-term goals that goes beyond the identification of program outputs. So maybe to put that a little more meaningfully, a theory of change approach is about making your forward-thinking narrative explicit and the assumptions that underlie your thinking. It's important to clarify how you see cause-effect relations between activities or actions, and then the intended changes of your program and your activities. When you're working with multiple people, odds are that each individual will have different views on what's the desired change, why is that desired, how it could and should happen. And so by having a joint TOC development process, it can help to understand what drives each stakeholder and how they understand the situation. It can identify what are the opportunities and the obstacles to impact, and it can also lay the basis for collaboration and clear definition of roles and responsibilities. And finally, it can outline what monitoring, evaluation, and learning processes are most relevant and at what stage, really helping to set your learning agenda. And we've used TOCs to kind of check the box against all of those different potential purposes. So I mentioned earlier that there's a lot of confusion between logic models and theories of change. And I often find that it's helpful to understand a concept when I have something to compare it to. So I wanted to compare the two here. A theory of change is less standardized than a logic model, but it has core components. It's outcomes-based and a causal framework that very importantly also articulates underlying assumptions. It was actually created in recognition that we needed to move beyond logic models to capture more complex change and more beyond just the specific program activities. So you can think of a TOC as something that requires justification at each step, where you have to articulate the hypothesis around why something will cause something else. And this also takes into account things that affect program outcomes outside of the program itself, so the broader context and system that you're operating in. Logic models, on the other hand, are focused on the program components only, the activities, outputs, and outcomes. And so it won't necessarily show you why activities are expected to produce certain outcomes. Here's another slide that outlines some of the differences between the two. What I want to highlight here is that the approaches can be used together, both a TOC and a logic model. If you conduct a full TOC analysis in the design phase of your program, you really should have all of the information needed to then develop a log frame, but it's one that's as realistic as possible. So what are the benefits of developing a TOC? I would say first, it can help to hone in on the link between activities and the achievement of long-term goals. This leads to better planning, and that activities are linked to a detailed understanding of how change actually happens. You can evaluate the right outcomes at the right time and at the right sequence, and this allows for more rigorous planning for measuring and getting to success. It makes sure that causal links, supporting evidence, and different stakeholders' viewpoints are considered. Instead of becoming fixated on what the program is currently doing, it draws people's minds to the activities that are actually needed to achieve the goals. And I think this is something that's important. You're not trying to justify what is currently in place, but trying to think critically about what is actually needed in practice. And by using a collaborative and participatory process, developing a TOC should involve discussion about existing understandings of how change should happen, getting you to articulate again your underlying assumptions. So through that process, you'll hopefully identify where there are structural inconsistencies or contradictions, especially around the cause-effect relations and the logic of the change pathways, or where you just have a lot of uncertainty about some of the underlying assumptions. You can use a TOC at the beginning of the design process to better understand the system you're operating in, to support change in a really strategic and responsive way. But I also want to emphasize that you can and should use it throughout implementation to learn from how the process evolves in reality, so that you can review and adjust your strategy along the way. So in many ways, it becomes your living, learning roadmap. All right, so I've talked a lot about some of the general principles of a TOC and how to define it. What are the actual inputs or main components of a TOC? So the first thing that I want to point out is that we recommend starting first with defining what you want to achieve. So working backwards to answer the question, what is the goal or the vision of the program? The goal or vision is the starting point of the TOC, and you want to make sure that it's clear and realistic in order to avoid having every possible activity and outcome included in this. Because developing a TOC involves quote unquote backwards mapping, so starting with the goal and working all the way down to the enabling factors and barriers, you want to make sure the goal is balanced with something that's both realistic but also ambitious. Then you can move on to the question of what outcomes does the program aim to achieve? And this generates outcomes with the focus on what has to be done to achieve the goal rather than what the current activities are. And then following on from that, you would ask the question, what activities lead to these outcomes? This is straightforward in that you're trying to articulate the interventions or activities that will directly contribute to these outcomes through your program. Now, I mentioned before the importance of articulating some of the underlying assumptions, and I think that comes into play in two different ways. The first way is outlining what assumptions are associated with each link in the causal chain. So this is both in terms of the links between outcomes, like will this short-term outcome result in this longer-term outcome, and based on what evidence. The links between activities and outcomes and other assumptions on the causal links in your TOC. Our assumptions here are basically our expectations of what will happen. So it's important to be clear that they are certainly not predictions, and as such, they often merit some critical questioning. And then at the end of the TOC, you have the question, what are the enabling factors and barriers for the program activities. And so this is identifying what else is needed for the intervention to work. And some people may articulate this as the current situation. And this is really about the assumptions about the context and the actors and factors at play that ultimately surround the kinds of activities you're trying to put in place and have a strong influence on the success or challenges that you might face during implementation. Now, one of the questions that we often get is, how do you recognize a good theory of change from a bad one? I already discussed the importance of having a TOC that tells a clear, understandable story. And I came across this figure and really like how it articulates the many ways in which you can turn TOCs into different products, the different processes you can use to develop a TOC, and then all of the different ways in which it can be applied. But in each instance, there are some general principles that are the same that lead to a strong TOC. So this isn't necessarily kind of a checklist of things to look for in terms of how a TOC is visualized or the content, but more the general approach that's applied in developing a TOC. And that's around having a participatory process, having a TOC that's based on the evidence, and that can be from research or best practices from elsewhere, in addition to reflecting the local knowledge and stakeholder perspectives, and articulation of the underlying assumptions, and then regular use and updating of the TOC. Okay, so what I'm going to do now is switch gears from what a TOC is to how you use a TOC, touching on many of these principles that we just spoke about. Here, you'll see a representative quote from someone who is just starting a new initiative, and they know what vision they want to pursue, and they have some sense of the activities, but because they're just kicking things off, they're not sure if the whole thing is aligned, how to communicate the overall strategy, and how to really prioritize their activities. So this is someone who's really just kicking off the design phase for a new campaign. So here we have the actual theory of change from a partner we worked with that was designing a literacy campaign. And their ultimate goal when we started off was to eradicate illiteracy in a relatively short time frame. I think it was something like 10 or 20 years. They had a number of disparate campaign activities that were trying to assemble together from previous years, but not necessarily a cohesive vision or sense of how they all aligned and if they were really the right activities. So what we did first was work with them in a participatory theory of change development process to develop a realistic vision that they saw as ambitious but feasible. And so that was really changing the vision to trying to close the literacy gap rather than eradicating illiteracy. And then we took a look at the outcomes that would feed into that vision and mapped planned activities to those outcomes. And what we saw were gaps where there were no activities contributing to outcomes at all, and areas where there were tons of activities that could probably use some prioritization or paring down linked to a specific outcome. And then we use this as a framework to build out a monitoring framework to track progress in the first year to really help to figure out what was actually feasible and adjusted the theory of change based on that. They were able to take this narrative and visual and turn it into something that was part of how they actually communicated what their campaign was, what the overall strategy was. And so it almost turned into an external facing product outlining the overall strategy for the literacy campaign. It also helped them think through internal staffing and roles and responsibilities around the different pillars of the campaign that they were pushing forward. And then our team actually used this to identify where within this theory of change there were opportunities to build in additional ongoing feedback loops and rapid feedback cycles. And we decided to focus on some of the new innovations that they were funding and testing in specific countries, and developed actually a mini theory of change within this one to hone in more on that. And so just wanted to emphasize the many different ways in which this could be applied, and also the point that one theory of change can lead to other versions as well within specific areas. Now, in the first Curve Summit, I talked through some examples of how we used the TOC exercise in our partnership with USAID to figure out where within the theory of change to focus rapid feedback testing opportunities, looking specifically for assumptions in need of validation. And so the next example I want to share here is from a situation where we were able to use a TOC in that exact way to figure out how to prioritize our learning questions where we had areas of uncertainty in the causal links. So what does that mean in practice? Here, you have 3 different ways in which the causal links that you've identified can play out. In a successful intervention, you can see that inputs lead to certain activities, which lead to certain outputs, and at the end, the expected outcome and goal change, so our theory of change is realized. This is the ideal scenario that so rarely plays out this way. It's not unusual to be in a situation where we do not see the outcome of goal change that we had hoped for. But without an articulated theory of change, we might not know why that is or where exactly the breakdown in the link happened. Is it because our implementation process was problematic? You see that in this example here, where our inputs were not sufficient or appropriate to implement the planned activities, or somehow the activities implemented did not lead to the right outputs. And so this is called implementation failure. On the other hand, maybe the implementation process was actually on the right course, our activities implemented as planned, and the services provided were good quality. But instead, we may learn that the theory behind our program was faulty. And so we have the breakdown here at the end of this chain, and this is theory failure. I want to share these examples here because it demonstrates how you can use a theory of change to really identify where the issue is exactly as you're kind of pushing forward the ongoing monitoring process. So in this example here, we were working on a program in Ethiopia and Tanzania to reduce under 5 mortality from pneumonia, which kills more children than from HIV/AIDS, TB, and malaria combined. The crazy thing is that there's an effective WHO recommended treatment, amoxicillin dispersible tablets or AMOX-DT, but access to this remains extremely low in many countries. We decided we wanted to do something about that to improve access to high quality and affordable AMOX-DT. So our team went through a backwards mapping exercise to figure out where exactly we wanted to focus. Was it on the supply chain side or the patient provider demand side? We recognized that both the supply and demand side had to actually be addressed in order for pneumonia to be treated correctly. And with that many steps, you can see how easy it is for the chain to break down. Here you can see that we focused on developing a TOC for the demand side for our engagement, looking at patients seeking treatment and their interactions with providers, and we mapped out what things would need to go right or change in order to ever get to an ultimate intended impact. Through this approach, we prioritized the links that would need actual testing to validate. So one example of this is provider knowledge of pneumonia diagnosis. Can they and will they give an appropriate pneumonia diagnosis? And if so, will this actually result in improved treatment rates? If you look at assumptions A and B, we didn't know the extent to which providers were actually using their knowledge to follow proper diagnosing procedures. And through quick formative research, we found out misdiagnosis was high. With children that actually had pneumonia, only 18% were correctly diagnosed by a random sample of providers. So that then led to a series of activities or interventions that we designed and tested around provider training for pneumonia diagnosis, testing 3 different low-cost and scalable approaches to provider behavior change: clinical mentoring, mobile messaging, and visual aids. So you can see how we use this to kind of hone in on the earliest stage design questions and interventions in need of refinement before moving too far along the pathway. So now I want to talk through an example of how we used a theory of change to test and validate some early informative design decisions in shaping a new program. This is a literacy and numeracy assessment platform for adults that was being designed in the US to do 3 things. 1, test literacy and numeracy levels. 2, test career aspirations and interests. And 3, based on these things, generate recommendations for careers and available resources. Based on conversations with the implementing partner, we co-created a theory of change to articulate all of these different pieces up here. But because this was really early in the design phase, we focused a lot on the assumptions about the current situation. So the enablers and facilitators to achieving our outcome, to improve literacy and employability skills in the planned activities they had started to design. We kicked off a formative research phase with these questions to try and actually validate some of those assumptions. And what we learned was that many of those were wrong. I'll walk through one example here. We had assumed that one facilitator would be that users would have access to technology to then access the platform. But our formative research showed that the folks that would be the primary users actually had limited access to the technologies they would need or the digital literacy skills needed to browse the content. That meant pretty big shifts in the activities that would work within this program. We were assuming people would just have access and the ability to navigate the technology platform, and we're realizing that we needed to add in inputs and activities to address the challenge that they did not, in fact, have that. You can see here all of the things that they had identified as facilitators were in fact barriers, and one of the barriers even turned out to be a facilitator. And so through this formative research, before investing too much in actually implementing some of these program activities and kicking off the piloting process, we were able to make a lot of substantial tweaks to the program design. Okay, so I have just shared a handful of examples that demonstrate how we've used theories of change at different stages for different audiences to answer different questions and for different purposes. I want to emphasize that this is just a very small sample of the many ways in which we've used and applied them. But in each case, the idea was to use the theory of change and the process for developing and validating it as a way to really come to consensus with the key stakeholders on the pathways to impact and narrative around that, and then to test and validate if and how this is true or not. So this can be applied in a number of different ways, but hopefully it sparks some ideas for you on how you can use a theory of change in a way that's actionable and valuable, and in the spirit of the CURVE initiative to get better faster. So that is the end of the presentation. Definitely welcome any feedback afterwards. And I think for now, I'll turn it over to Tom and M&C Sachi to open it up for some questions from folks.
Thank you so much, Christina. That was equally as fascinating second time round as it was in December. And really, as we wait for people's questions, just one from myself, because it was really interesting, well, encouraging and inspiring actually to hear you say, obviously to some degree you're self-taught through a lot of experience doing theories of change. But I wondered, are there any really useful online resources that you found as you've been learning? I noticed there the HEVOS TOC guidelines were referenced on one of the slides, but I'd love to know more about other sources that you think are particularly useful to develop a good theory of change.
Yeah, I'm actually glad that you brought up the HEVOS toolkit, because that's probably the one that I've come across to date that is the best, partly because it articulates based on where you are and your level of experience in developing a theory of change, the extent to which you can work with just a standalone toolkit to develop it. And I think I'm always quite hesitant about just handing someone a framework or a toolkit and saying, good luck, Godspeed, here you go. And we found that the most meaningful engagements have been those in which we can actually facilitate a process, so have someone outside of the program work closely with the program implementers or key stakeholders to actually develop a theory of change. But obviously that has some challenges in terms of the sustainability of actually getting this approach out there, or scalability of it. So I would definitely point to the HEVOS toolkit. Honestly, there is a plethora of information that is out there, and that's one of the things that we at Results for Development are currently thinking about, because to date, we've been involved in facilitating a lot of these processes, and so I think we're now trying to get to a point where we can actually codify what this approach looks like and provide just some standing guidance for folks. I know that coming out of the Curve Summit in December in particular, one of the big asks was less around how to facilitate the process, but more around how do you even know if a theory of change is good or not that you're looking at? Is there a checklist that I can turn to? And I think that's something that we would be really interested in kind of pursuing and developing over the next few months. So I don't know if that's helpful or not, but those are some of my thoughts.
Yeah, that absolutely was. Thank you so much. And certainly when, as you progress with that thinking, that would be really, really great to see that, and again, to share it through the Curve as well, because I remember exactly the same response, people asking, how do I know if this is a good one? And I guess as we wait for people, by the way, if anyone does have questions, you can also use the chat function on GoToMeeting to ask the questions, or as I say, email thecurve@mcsaatchi.com. But another question that just occurred to us as we were listening is, in terms of what makes a good one, I guess a good one takes into account contextual factors. You mentioned a participatory approach, which certainly is really interesting, and from our experience as well, makes for a much stronger theory of change. How are there any other techniques you use to ensure that you're getting contextual factors rather than sort of the theory of change becoming this ideal scenario that sort of likely can't be achieved?
Yeah, I definitely think the whole approach of creating a problem-driven theory of change, so starting backwards rather than with the activities that are already in place, is really critical to ensure that you're not developing a theory of change that just justifies the model that's already in place, but rather develops a critical thinking process to actually say, all right, what are we aiming for and what's actually going to get us there? And do the activities or interventions or ideas that we have in mind actually contribute towards that? And some of that can easily be sussed out just in the process of developing a TOC. I think I described a little bit of that with the first example around the literacy campaign. But some of those underlying assumptions actually need some ongoing monitoring and experimentation to actually tease out whether those assumptions are valid or not. And so that gets back to the point of actually using the TOC as a living and learning roadmap over time, and updating it on an ongoing basis. The other piece, just related to making it a participatory process, is making sure that it's not just involving program leadership, which I think can often be the default or bias, but that to the extent to which it's possible, you're involving folks that are going to be involved in direct implementation of some of the activities. So some of the staff that'll be based in the field, and then also involving the potential beneficiaries of the different services. And, you know, that may not be feasible to invite them to sit down in a room and actually pull out some Post-its and draw a theory of change together. But what we've done is make sure to really draw out the beneficiary or local stakeholder perspective through formative research, right? Because a lot of the assumptions that the program staff are building are based on their own experiences, but that may not align with what's actually happening in the local context. And so that's where I think a lot of the importance of formative research comes into play, of using focus group discussions and key informant interviews to actually bring in the voice of the folks that will be directly affected or receiving some of the different services.
That's really useful insight. Thank you so much, Christina. And we do have a request from Claire Finkel from the Gates Foundation asking, please speak more to the relationship of the learning agenda to the theory of change.
Yeah, so I think one of my favorite examples of how we've done that is through the third example that I included on the adult learning program, and how we use the theory of change to first produce a co-created theory of change where we outlined what were some of the underlying assumptions, what was the current scenario or situation we were operating in. And then we realized that before they kicked off the piloting process of the program, that there was some time for us to do this formative research to actually validate and assess some of the underlying assumptions. And so that was the starting point for our learning activities that we wanted to push forward before implementation even began. And through that process, we learned that a lot of the foundational assumptions, like assuming that technology was accessible and that the adults who would be using the technology were tech literate, those were false. And if you think about it, if we had just kind of gone straight into program piloting, that would have had huge implications for the kinds of outcomes that would have been achieved. And so before we even did that, we were able to use the formative research to say, whoa, actually, we need to revisit this theory of change and actually change some of the different assumptions that we have articulated here, were some of the things that we thought were facilitators or that contributed to ongoing potential to reach success of the program, were actually things that needed to be addressed in the design of the interventions themselves. And so that led to conversations with the implementer around whether it was feasible to have something like tech literacy programs, or if we needed to shift who our target audience was, or if we needed to shift the total design of the intervention itself. And so that's one small example at the beginning, and that's kind of the stage that we're at now. I think if you were to fast forward into the future, we would ideally make some tweaks to the actual intervention and then use the theory of change to develop the monitoring framework to track progress against the different activities on an ongoing basis, but then maybe find some other areas of uncertainty where we may want to do some experimentation. So let's say that we decide that we do want to actually invest in some tech literacy programs. It may not be something that the implementers have a lot of experience with, and so we may want to actually pilot different versions of that over a short period of time and compare which of those alternative intervention options is ideal to pursue before kind of scaling this up longer term. And so that's kind of how we envision this being a living learning agenda, where the idea is that you use it to really prioritize the learning questions and activities that you want to implement to measure progress against them. And then as your certainty grows, as evidence is generated, you update the TOC based on that and say, okay, what's the next area of uncertainty that we have within this?
Fantastic. Well, thank you very much. We have no more questions at this stage, so unless someone has a burning question and desperately typing but not going to be able to get it, please do speak out now. Otherwise, I will say a big thank you to Christina for giving her time to give that presentation again, which I think we'll all agree is a hugely useful one for those of us working with theories of change and implementation of programs on the ground. And also to say that this webinar has been recorded, so we will be uploading it to our Springboard page and sending round a link to that so that you can rewatch it at your leisure and share it with colleagues as well. But unless anyone has any final questions, it just is for me to say again, thank you so much, Christina. Hugely appreciate you taking part again and being such an active participant in the curve and sharing your insights with us. And we will dial off. Thank you everyone for joining.
Absolutely, that sounds great. I have my email up on the slide, and so if folks have any follow-up questions later on, or as they're working through the process of either developing a TOC independently or working with grantees and other stakeholders, please do feel free to reach out. As I mentioned, it's become a little area that I care a lot about, and so I'm always excited to discuss TOCs.
Great, thank you. Goodbye everyone, see you next time.